The thing that annoys me the most about this topic is that when someone's told that they're insulin resistant, or maybe that even in more extreme cases that they're a type 2 diabetic, because type 2 diabetes is really just a more extreme version of insulin resistance. But when they're told this, they're just given the sense that, these are the cards that you were dealt and this is just the way that it goes. Oh, your mom had high blood sugar? Well, I guess you're going to have high blood sugar. Your dad was over 300 pounds? Well, it looks like you're going to need some bigger pants because that's what you got. Sorry about your luck. It's genetics. It just makes sense. But the reality is that we have the ability to change how the genetics that we were given affect our body. So in this video, I'm going to help you understand why we actually become insulin resistant. And when you understand that, you're going to understand that you can take steps to correct it. This is going to be awesome.
T.C. Hale is not a doctor and does not claim to be a doctor or licensed in any type of medical field. Don't be an idiot and use anything heard on the show as medical advice. This information should be used for educational purposes only, and you should contact your doctor for any medical advice. Now get off me.
So when we want to understand insulin resistance, we can use the analogy of how morphine works. If someone goes to the hospital and they're in horrible pain, the doctor can give them morphine and that will reduce that pain. But over time, if the person needs to continue using this morphine to keep their pain down, the cells will become less receptive to that morphine and the doctor will have to increase the dosage to get that same effect. But if the person stays in pain for a long period of time and they have to continue using this morphine, eventually the cells will stop listening to it altogether and the morphine will have no effect and the person will stay in this extreme pain. So when we're looking at insulin, we're looking at a similar situation. When we eat carbohydrates and our body turns those carbohydrates into glucose in the bloodstream, then that tells the pancreas that it's time to make some insulin, and the insulin tells the cells to bring this glucose in there and let's turn that into energy or we can store it for later on. So while this insulin is elevated in an effort to get this glucose out of the bloodstream and get the glucose where it needs to be, this insulin also tells the cells, hey, don't burn stored fat because we have plenty of glucose to use for fuel right here. Don't burn it. Don't burn stored fat. We have glucose. We got to use this up first. So the problem is that we can burn up our glucose pretty quickly, but insulin takes a lot longer to come down. So then the person runs out of glucose. They don't have any energy. They're kind of bonking. It's 3 o'clock and they're getting that coma after lunch. And they're like, man, I really don't feel so great. And the reason is because they ran out of glucose. They burned all that up. But insulin is still too high and still signaling the cells not to burn stored fat for fuel. Well, this stored fat is the backup fuel source for the body. So when the person runs out of glucose, they should be able to access this stored fat and keep a steady flow of energy going. But since they ate so many carbohydrates and sugars that they spiked this insulin into a high range, they don't have the ability to access that stored fat. So they say, well, that commercial told me I should have a candy bar, a nuggety nutty candy bar, because that'll make me satisfied. I want to be satisfied, so I'm going to have this sugary carbohydrate snack. They eat that, they spike blood sugar again, and they spike insulin even higher. So insulin never really has a chance to come down and allow the body to access that stored fat and burn that as fuel. So now it makes a little more sense why we often see weight gain with insulin resistance. Now here's what we need to look at to understand why does one person become insulin resistant, but Sally over there, she didn't become insulin resistant. One of the factors that can determine our bio-individuality is the ability for our insulin to be effective. The reality is that there is no diet that's right for every person because we all process foods differently. So two different people can eat the same cookie and have wildly different responses. Let's say that John over here eats a cookie and that raises his blood sugar level to 120. And I'm just making up numbers here. Don't view like, hey, every time I eat a cookie, my sugar's going to go to 120. I'm just making stuff up. But John's blood sugar goes to 120, and Sally eats the same cookie, and her blood sugar goes to 120. But Sally over here, she can use this much insulin to bring her blood sugar down to 80, just like that, using a very small amount of insulin. Her insulin was effective enough to bring that blood sugar down at a good rate. Now John over here, with his 120, he needs to use this much insulin to get that down to 80 because his insulin is not as effective. Now there's a variety of factors that can affect the ability for insulin to do its job well. Just like when we talked about the morphine in the beginning, eventually the cells would no longer listen to that morphine. Well, if a person's insulin is high all day long, It's basically like insulin is just screaming at the cells all day, hey, get the glucose, you gotta get the glucose, why don't you get this glucose, you gotta get the glucose in there. Well, eventually you're not going to listen to that. So if we're eating in a way that we're continuously spiking our glucose all throughout the day and raising that insulin level that takes a lot longer to come down, insulin is gonna be high all day long, yelling at the cells all day long, and eventually those cells won't listen. Now, even before that happens, it appears that our urine pH has the ability to kind of dictate a little bit the effectiveness of our insulin. And I don't want to say the strength of our insulin. I don't think that's actually how it works. But it appears that when our urine pH is lower, that tends to coincide with someone needing to make more insulin to get the same job done. And when urine pH is higher, the insulin seems to be a little bit more effective. Now, this isn't always going to be the case. This is not diagnostic. It just seems to be what we see with our clients and with the practitioners and doctors in more than 40 countries that study with us. So you can look at your urine pH just by picking up urine pH test strips on Amazon or a local health food store. And you can look at your urine pH at least 2 hours after a meal, but not fasted first thing in the morning. And if that urine pH is 6.0 or higher, that can be an indication that insulin may be a little bit more effective. And if it's lower than 6.0, down around 5.5 or so, often that's when we see people that are leaning a little bit more on that insulin resistance side. It's really common when we look at type 2 diabetics to see their urine pH very low. Now, it's not such a direct response that you can just raise a person's urine pH and all of a sudden they're not insulin resistant anymore, but it seems to help the process move along a little bit faster. And I'm not talking about having some alkalizing diet. There's a lot of fiction in that whole world. I don't want you to go that route. It's more about correcting what we call a catabolic imbalance. And I'll point you some information that you can understand that a little bit better in a minute. But what's important to understand is that there's more than one factor that can dictate how much insulin your body needs to make to get the same job done. And what we really need to look at is that this can take a long time to truly develop. So as the body says, hey, I can't get the job done with this amount of insulin that I'm making, I'm going to make a little bit more. Well, now I bring the blood sugar down where I want it to be. That worked. It was great. But over time, and the more carbohydrates and sugars I consume, the more insulin I'm going to need to make to get that same job done. Well, eventually my insulin is up here. I'm full cranked with my pancreas shooting out as much insulin as it can possibly handle, and yet my blood sugar's in the perfect range. So when I check my blood sugar, nailed it. I'm really in a good range. I got things going great. But behind the curtains, everything's going havoc. Everything's going crazy because you're having to create so much insulin to get that job done. And eventually the pancreas gives out. It can't continue to produce insulin at that rate, and then blood sugar spikes because you can't make enough insulin to keep that blood sugar in the good range. It's almost like a person becomes type 2 diabetic overnight sometimes. So when we look at this process, it's not something that happens on a Thursday. This usually is going on over years, and we just don't see what's happening because we're not testing our insulin levels. We're just looking at our fasting blood sugar. Even if we're wearing a continuous blood sugar monitor, we might not get the whole picture because the pancreas is making enough insulin to keep that blood sugar in the range where it should be. And then all of a sudden when the pancreas gives out, a la peanut butter sandwiches, we're type 2 diabetic. So it really becomes about this combination of factors of the level of carbohydrates that you're consuming, the frequency of those carbohydrates and or sugars, and your body's ability to process that level of carbohydrates and sugars. It's all those factors together. And that's why one person will do fine eating buckets of carbs all day long, and another person is creating real trouble. So when you understand how this can come about, to fix it, it's really all about understanding why does my body feel like it needs this many carbohydrates and sugars, and what can I do to correct that? And what steps can I take to help my body better process the carbohydrates and sugars that I am eating? So what I want you to do right now so that you can better understand the steps that you can take to fix this situation and figure out, is this catabolic imbalance that we talked about, is that part of my problem? Go ahead and jump right now over to our video for 5 steps to fix insulin resistance so you can see how easy this can be to just make some adjustments to turn this whole thing around. Come on, let's get over there now.